The 76th World Health Assembly kicked off its week-long meeting in Geneva, Switzerland yesterday, bringing together representatives from the World Health Organization's 194 member states. Now, you would think that the WHO, that responded so poorly to the Chinese coronavirus pandemic, would want to put that behind them. No, not at all. Because they found that fear-mongering gave them power. So they want to keep it going.
The end of COVID-19 as a global health emergency is not the end of COVID as a global health threat. The threat of another variant emerging that causes new surges of disease and death remains. And the threat of another pathogen emerging with even deadlier potential remains.
That was Dr. Tedros Ghebreyesus, the Director General of the World Health Organization, earlier today. Now, one of the first items of business today was actually to increase the mandatory fees of member states by 20%. That's just one of the many things they're up to this week. Well, former Congresswoman Michele Bachmann is in Geneva, and she joins me to discuss what the WHO is up to this week, and in particular, the pandemic accord that the WHO is pursuing that would essentially give them global police powers, threatening our freedom in so many different ways. She served in Congress for 8 years and is now the dean of the Robertson School of Government at Regent University, as well as chair of the board here at the Family Research Council. During her time in Congress, she served on the House Permanent Select Committee on Intelligence. Dean Bachmann, welcome back to Washington Watch. Thanks for joining us.
Tony, thanks so much. It's great to be with you from Geneva, Switzerland tonight.
So tell us what you're seeing and hearing there on the ground. You've been there through the weekend. You were there for the start of the meeting. What are you hearing?
Well, exactly what we thought was going to happen. All of the documents that we've been reading for over a year that would establish a platform for global governance through the World Health Organization are exactly, without blushing, this is what they intend to do and what they plan to do. They're not going to do it this year. We thought it was going to be done, but they're making sure they perfect it over the next year. So there's a dual track process that they're following. One is through a global pandemic treaty that they're calling an accord. The second is through a package of about 300 amendments to the international health rules. Both lead to the same result. Both lead to the creation of a platform for global governance through healthcare. And it is a web that locks us in the likes of which we've never seen before. The interesting thing to me, Tony, is that there were no members of Congress here. I was actually shocked because this has been a big issue that a lot of their constituents have rightfully been very concerned about. There wasn't one senator here or his staff or her staff or one House member or staff. There was no American press here. So how would anyone even know what was going on unless they tuned in and they watched for themselves? One thing I was shocked at today, Tony, is the conversation that was being had over COVID was exactly the view that the World Health Organization took at the beginning of COVID. We've learned a lot of things in the last 3 years, haven't we? And the World Health Organization bungled almost everything, whether it was masks or vaccines or lockdowns. But yet they acted like nothing happened. There was no review. They acted like everything was just normal. And they're planning to go ahead with all 300 amendments. As a matter of fact, they gave their strategy today. They're planning to meet in New York City in September. They'll go over the progress that they're going to make. In January, they'll give a final completed package of the 300 amendments together with a global pandemic treaty to the World Health Organization and the UN and the World Health to the World Health Organization. And then they'll meet again in Geneva next February. But 1 year from this week, they will take the vote. And so they intend to vote for a platform for global government and to give themselves the power that no one has ever seen before. But I was actually kind of shocked, Tony. Today, the Bill and Melinda Gates Foundation was at the World Health Organization. They were having meetings. I was shocked at the concentration of global power in Geneva. I had no idea how close it all is together and how powerful it is. The World Trade Organization, the World Health Organization, the United Nations, directly across Lake Geneva from the United Nations is the official world headquarters of the World Economic Forum. All of these organizations are together. And one thing they said today in the meetings is that we want to increase global governance. We want to increase it here in Geneva, and they want Geneva to be the site for the global governance.
Wow, Michele, there's a lot to unpack there. So let me just jump in with a few more questions. First, clarifying for our viewers and listeners, the World Health Organization has been an advisory body. I mean, member states can take it or leave it, whatever they say. Fortunately, in most cases, they've left it because they're so misguided. But under these new amendments, these amendments that are being pursued under their current policies and the accord, it's being called accord so they can avoid having to get it ratified as a treaty, this would move them from an advisory body to one that actually has jurisdiction over every governmental entity, including those here in the United States.
Well, that's exactly the point, Tony. That's right. All 194 member nations would be under the thumb of the World Health Organization. And what the Director General Tedros Ghebreyesus has to say, whatever he dictates, that's the way that it goes. People need to know what this means. We were all upset with Dr. Fauci when Dr. Fauci would wear one mask and then all of a sudden he'd show up with 4 masks on and tell us we had to do that, or churches had to close down, schools had to close down. Now that level of power and authority would move to the World Health Organization in Geneva, Switzerland. So they'd make the decision for Pasadena, California, or Keokuk, Iowa, or Raleigh, North Carolina. They would be making the decision. We would have nowhere to go to appeal. You know, I've talked to a lot of members of Congress about this, Tony. I have begged them to get involved. I've talked to members of the United States Senate. They've all looked at me and said, this will never happen. This will never go through. Members of the Senate will never approve of this treaty. Well, I have news for them. The World Health Organization has no intention of allowing the global pandemic treaty to come back to the Senate to be voted on. Why weren't the senators there today? Why don't they get the current copies? And their copies are all sitting there. They're on the website. Get the copy of the pandemic treaty. Start holding hearings on it. Bring in the Biden administration. Today, I heard from Secretary Xavier Becerras, the head of our Health and Human Services. And Tony, he said he wants more biosurveillance. In other words, surveillance of our bodies. And then they want to share that data with everyone else in the world. This is highly invasive. They were very clear today. They want very bold language. They intend to have surveillance over every citizen on Earth. And they intend to be in control, and they intend to control us through healthcare. So we need our senators to wake up, hold hearings, pull these documents in, start to review them, because if they're thinking they'll wait until January, that's pretty late, because the next meeting will be in Geneva in February. The final vote will take place in May. So they should have been there this week, Tony. They should have been there this week, but they need to pull this in the Senate. And I would call on Kevin McCarthy, as he is doing this negotiating for raising the debt ceiling. I would put on the table that Joe Biden has to get the United States out of the World Health Organization and pull the funding for the World Health Organization as the price of raising the debt ceiling.
So, Michele, if I'm not mistaken, as I read through what they're proposing, we're focused on the pandemic because we just, we came through the coronavirus pandemic, but this goes beyond just pandemics. I mean, they can declare any health crisis. I mean, I'm looking at some of Ghebreyesus' comments. Climate. He says climate is a crisis. Yes. We're talking about gender reassignment surgeries. We're talking about abortion. I mean, there's a lot that falls under this umbrella.
Yeah, racism. So they've got this concept they talked about today, Tony, called One Health. And they've got graphics on it, and they show humans, animals, the earth, One Health. So when decisions are made about healthcare, they have to take into account the earth and what the impact would be on climate change. And then they have to take into account what is the impact on smelt or a rodent. So what it boils down to is humans equal cockroaches equal a clump of dirt. And so here the director general will be making decisions about healthcare or lockdowns or vaccines or whatever he's going to make decisions about. And we have as much value to them as a cockroach and a lump of dirt. That's why you don't want to give up decision-making authority to someone like the Director General of the WHO. They have a very different agenda at hand, and this is an agenda for global governance. And I was shocked. I didn't realize until I came to Geneva this week that Julius Caesar actually came to Geneva, Switzerland, and the Roman Empire ended at the Swiss Alps. He wanted to make a name for himself. He wanted to be great. So he came to Geneva, Switzerland. He had a skirmish with some of the Swiss, and he expanded the Roman Empire all the way to the North Sea. So he doubled the size of the Roman Empire. And it looks like what's happening here, Tony, is a revival of the Roman Empire again. They talked about it all day today, how they want to expand global governance and how they want to expand the power and authority here in Geneva, where it's the World Trade Organization, the World Health Organization, the United Nations, the World Economic Forum, the International Red Cross. All of these international organizations are here. This is a major finance center. We were told this is the second largest center for trading oil in the world. The amount of money that's here is unbelievable. There's black Mercedes everywhere. The Four Seasons Hotel is all full of these people, and the Ritz-Carlton is full, and all the fancy dinners and everything that's going on. These people have big plans for us. And what they want is a global governance system, and it will upend the American form of government forever.
Michele, that sounds like a few of the pieces from the book of Revelation coming together.
Yeah, that's what I thought when I was here this week. I thought we need to wake up. We need to watch what's going on. Anyone can look at this information, Tony. Anyone can watch these sessions. All you have to do is go to the World Health Organization, World Health Assembly, and just put it into your browser, and you can watch all of these sessions and see what's going on. All the documents are there as well. Every single member of Congress should read these 300 amendments. They're planning to pass them all. That's what the guy in charge of the amendments said today. They're planning to pass them all. They think they're perfect the way they are. And the Global Pandemic Treaty, they think that language is perfect the way it is. People need to read this treaty. It'll make your hair stand up on the back of your neck. At the loss of power and freedom that we will have if this passes, and it'll pass. No one objected.
Right.
That was the other thing, Tony. Not one objection by anyone. It was a me too, I agree party. I was just shocked. There was no free discussion. I was sat in on a round table. There's no free round table discussion where people shared ideas. It was all pre-baked, and everyone said, I agree. We got to do this. And it's urgent. And the number one word that they used besides urgent was equity. We have to have equal outcomes for everyone on earth with universal health care, meaning they said, we've got to look at all the money we have to spend. We don't need to look at our budgets. And for those countries that are producing health products, they need to produce more health products and give them away to the world. So one thing they didn't do, they didn't focus on any new breakthroughs in medicine. There was nothing about health here. There was nothing about medicine. There's nothing about breakthroughs or cures. Everything was about giving themselves more power and more authority.
Control.
Yes.
It's all about control. There is a bill, H.R. 79, I think Andy Biggs is the author of that bill, that would withdraw the U.S. from the WHO. But we're almost out of time, Michele, but I want to put a fine point on something so people don't think, well, this is just business as usual. We've had the United Nations before. This is just one of their agencies. This gives the WHO more power than the United Nations has ever thought about having.
That's right. The United Nations has loved to have this power. And after the beta test of COVID in the last 3 years, they had a taste, a delicious taste of what power felt like.
Yeah.
And so now they're going to go for the gold and grab the whole enchilada. They want the full fount of power so that no Tony Fauci can ever make decisions again. Now they want all the decisions made out of Geneva.
Michele, thanks so much for taking time to join us. We're out of time, but hopefully we'll touch base with you later in the week as well.
Thanks again, Tony.